Joy Pate, the Director of the Area Agency on Aging, and this is Age Well with Joy. So today we are very excited to have a special guest with us. Everybody knows that about 10,000 people are turning 65 every day, and that has a lot of complications with it. But today we have Sandy Leith. She is the Director of the Senior Health Insurance Program we call SHIP at the Illinois Department on Aging. So welcome, Sandy.
Thank you. Nice to be here, Joy.
Yeah, can you tell us a little bit about SHIP and what it is?
Sure. Senior Health Insurance Program sounds like we sell insurance, but we do not. We are there for you. So we're your Medicare dollars working to be advocates, to help answer hard questions, to get you out of tangles, and to find somebody to sit down with you one-on-one when it comes to Medicare, other insurance. When do I retire? Why do I take Medicare now? Why don't I take Medicare now? All of that. We have the expertise. We have certified counselors, and we're there to help you as a free service. This is your free service, and partners like you, Joy, and your staff and many counselors in your area help. Some volunteers, some are paid in-kind counselors that do this every day, and they're all part of our big network, and we're there to help you with your Medicare, basically. That's our ship. That's our boat.
We do have 5 senior health insurance counselors in our office, and of course, we have a very broad network in the Metro East that can help people with their SHIP questions. So, Sandy, if a person's going to be turning 65, how can a person get this Medicare information?
Yeah, there's a lot, and you're probably way before you turn 65, you're going to be getting mailers, and a lot of times we get callers just because of that. Hey, I'm getting stuff in the mail. What do I do with this stuff? Do I have to sign here? They say they're from the government. And a lot of times things look like they're from the government just to get your attention, but they're trying to sell you something. And it's just a time to absorb a lot of material. So if I were getting ready to go on Medicare at least 3 months prior to, say I'm coming up on age 65, I would start reading up on that. And there's a great booklet called Medicare and You, the 2021 booklet, and we have those in our office. We could always send you some. I'm sure, Joy, you guys have some too. I actually have it. It's going to come up backwards, but just showing you the red, white, and blue always shows people that, oh, I get that in the mail, or my spouse gets that in the mail. And that's a best read 101 on Medicare. Visit Social Security's website and visit medicare.gov, because they'll have buttons saying, get started. What do I need to do? And that's where you start reading, start getting in tune, and call us. Call a SHIP counselor, and we can go over all the ins and outs with you as well.
So, Sandy, can you tell us what do people have to do with Social Security?
So Social Security is the eligibility force, the federal entity that will, okay, are you ready for Medicare? Are you age eligible? Did you pay in via taxes to get your Medicare, or did you, or a spouse, or a divorced spouse, or a deceased spouse? So they've got all your records for life, right? So they're the ones you would check in with, and there's actually an online apply for Medicare. There's checklists out there at ssa.gov. Oh, it's wonderful. I was visiting that, just getting ready for this interview, and was kind of taken back on how easy it is to follow. And I think with the pandemic and everything being online and offices being closed to the public, it's really become a better tool than it would have ever become. So you can do a lot of things online as to figure out, am I still working? Is my spouse still working? Am I ready to go on to Medicare, or should I put it off because I am working and I'm on another employer plan? Whatever. There's so much to think about. The first thing you need to do is check in with the eligibility entity, which would be Social Security. And you can get to a local office and have a phone interview, and that is all hooked up through the Social Security website. There'll be a place to find your local office and actually get a local phone number to a local person who will do a call with you, or a Zoom, or whatever works for you.
If you go to our local office here, they will send you directly to AgeSmart for the next step, which is great. But so there are lots of parts of Medicare. Can you tell us about, Medicare Part A, B, what's C, what's D? What does it all mean?
Yeah, and there are different parts, and there's different times to take it and different times you don't have any business taking it. It's a waste of money, depending on you, depending on your situation. So if Part A is hospital insurance, I always say it's room and board when you're in a hospital bed or a skilled facility rehabbing from a major injury or a surgery. It's also can be hospice when someone's terminally ill, less than 6 months to live. They would be using Part A. Part A is the thing that you get by paying into taxes, or your spouse paid into taxes, or your deceased or divorced spouse, depending on if you were married for more than 10 years. So there's so many. I can collect off of a divorced spouse if I never worked and paid in enough to Medicare. So Part A is something I would get at premium free most of the time because I'm hooked together with somebody who paid in enough taxes. That's my hospitalization. That is not going to even begin to cover most of your health care, which would be Part B, and that's everything from doctor appointments to lab fees to going to the emergency room to get your MRI at the hospital. That's all Part B. Anything that's not lying in a hospital bed or a skilled nursing facility is Part B, and it's huge. And so that's something that you elect to take. And, that's a big question. Do I take it or not? Well, do you have other insurance? And what is it through? And there's tons of questions to ask about that. But that's B. B is medical. We call that everything outpatient, okay? A is inpatient hospital, outpatient medical would be B. Part B is even if I'm in a hospital and a doctor comes to me and assesses me, they're going to charge me a fee because I didn't walk into their office. They walked into my hospital room. Part B will pay for that doctor visit also. So Part B can be inpatient stuff as well. Part C is taking those medical and your inpatient hospital Part A and rolling them into one thing, you might have heard of an HMO or a PPO or a managed care plan. So Part C is A and B put together, run by a private company. And then D, in a nutshell, is just drugs. And thank goodness D and drugs are the same alpha letter. It makes life a little easier. But so Part D came out in 2006, and it's an additional drug benefit that you may want to take. You may not. You may not have to. You may have retiree insurance. But just know there are different times to sign up for these things, times not to sign up, and there are penalties for late signing up. So it is a big deal coming up on Medicare. This is a valuable segment in that, let's talk about all the ins and outs and why you need to sign up. And I've got one resource that I think, I've been doing this for 25 years, Joy, and it's Medicare and Other Health Benefits, Your Guide to Who Pays First. I'm a book holder, but it's a really good book written by Medicare, Your Guide to Who Pays First. So it gives you that guide of, you're still working, you want to ask this question, or you're disabled and now your spouse is still working, or maybe they're quitting to work. It's actually called publication number. Let me see if I can find the number for you. 02179. So it's a Medicare publication 02179, Your Guide to Who Pays First in Medicare. Best read for people trying to make that decision. And of course, they'll be talking to one of your SHIP counselors as well, going over the scenarios.
So that is really interesting. There's a lot of advertising from those private companies that are part of that Medicare Advantage plan. So can you explain how a SHIP counselor can kind of help you figure out what's the best thing for you? They don't make decisions for you, obviously, right?
No, they'll point out all the. Medicare is all about choice. So there's a lot of choice, a lot of choice. And so the counselors kind of corral all that crazy information that you're getting and bring it down to an understandable method for you. And they can compare things. They can, and then they're going to look at your situation. What is your personal situation? Are you still working? Well, that changes the ballgame big time. And people are, after age 65, people are still, they're still going into their new careers at that time. So we need to look at all that information and put it together with years of experience from your wonderful counselors and resources like this, Who Pays First, Your Guide to Who Pays First, and figure out, okay, what Medicare Advantage plan? So if I'm in Belleville area versus I'm up here in Springfield, there's going to be a different managed care market than what you have in Belleville. So your SHIP counselor is going to look at your zip code. Where do you live? And they're going to tell you the choices that are out there, and then you start comparing and contrasting. And then what do you do? Do you travel a lot? Do you go to Texas or Florida for 5-6 months out of the year? Is that going to be a good deal for you to take a managed care plan? Because a lot of times there's a network and it's based on your home and where you live. Well, if you're going to live separate areas for half the year or so, maybe that's not a good deal. So, so many factors to take in, but those are private companies. So when you're talking about a Medicare Advantage plan, it's a Part C plan. It's managed by an insurance company. It's not just any insurance company. Medicare has approved them. You know, they made sure that they have doctors and hospitals and all the T's crossed and I's dotted for your health insurance. But is your situation good for a Medicare Advantage plan? People love them, but then again, if people travel a lot, they might not want to be in something like that. So counselor definitely is a key, what do you call that, a key factor in looking at what's the best scenario for you.
So in this region, we have a lot of military retirees. So they have TRICARE for life, and we have railroad retirees and who have their insurance, and people for their part of their pensions have insurance. Can you explain how that other insurance and Medicare work together?
Right. So, yeah, I have a retired aunt in Mascoutah, and aunt and uncle there, they have TRICARE for life. So his employer plan, which was another career after the armed forces, did not go with him into retirement. So thank goodness he doesn't have a retiree plan and Medicare, but he has plain old Medicare A and B, and then the TRICARE for life is his drug plan, and it's managing all of his care. There's a network, and they'll have different rules. But they don't need, if they were coming up on age 65 and everybody was sending them all these managed care brochures and Medicare supplement brochures to buy this, buy that, they don't need anything like that. TRICARE for life is there for life, and it's good insurance coverage. It's wonderful. It's kind of like a managed care plan, but it's sponsored by the armed forces, the federal government. As opposed to, let's say you've got somebody who's a retired airline. We have a lot of retirees from your area that ask us, I've got an airline retiree insurance, and they're wanting to know how that works. Well, it depends on that employer plan. So if you're retired and it's going with you into retirement and you're paying for some of it, maybe the company's still subsidizing it, it's only as good as the contract between you and that employer. So a ship counselor has to get on the phone and start asking, real invasive questions. How do you pay if a person were to be hospitalized? Are you going to pay the deductible? Do you wrap around Medicare and cover everything that Medicare does not? Or are you going to, put a big deductible in the way? Or how do you work? Do you coordinate or not? And that's kind of hard, but that's the kind of stuff that counselors do every day, so they know how to dig for you and find out what is a good scenario.
Yeah, I love the Who Pays First book. That's probably good reading before you come to a counselor to have all your questions answered, written down.
Yeah.
So
I'm having a trend, Joy. It's COBRA insurance. It seems to be a trend that people are leaving the workforce, and the employer is thinking they're doing a great service to them and offering them free insurance called COBRA. It's unhooked from their employer plan, so it's not any longer an employee plan. It's just a private policy that's a subset of what they had when they were working. But when it comes to taking Part A and B of Medicare, it's very important that you take those and not rely on that COBRA. And some people want to just hang out on COBRA till they're 65, 70, whatever age the employer will let them have that plan. And then they're going to face penalties later for signing up for Medicare Part A and B. So all of that employer stuff, just you almost have to have a counselor every time when you're coming off an employer plan. And if it's offering you something to go into Medicare with you, you better check it out.
right, even if you're still working after 65 and your employer offers insurance, the size of the company I know matters. So we're a small employer. It makes a big difference on whether you take B or not.
Yes,
So
yes.
always have to ask. And then a couple other questions. So you mentioned, you were talking about there's a time to sign up. So we know if you're turning 65, you should start this process at what point?
Usually around, if you're turning 65, you should start seeking information about Medicare, if you've heard nothing from the real federal government, 3 months before your birthday month. So if I turn 65 in March, then I want to back it up about 3 months prior to March, because I just don't want to. It takes time to hook up Medicare sometimes, and some people are automatically hooked up to Medicare. And a rule of thumb is, if you're collecting your Social Security benefits already, your Medicare will automatically come flying into your home. Here's your red, white, and blue Medicare card. In fact, I have kind of a sample behind me here. But your red, white, and blue card will come in the mail to you. Why? Because you're already hooked in with Social Security. They know when you're doing what, and your enrollment is automatic. It's the people who aren't, they're continuing to work, or their spouses, and they're growing their Social Security, and they're not collecting those benefits at age. What can we get? We can get them at 62, but full benefits are into 66, 67 at some point. So some people are waiting, and they're the ones who are going to have to say, hey, Social Security, kind of rattle the cage and say, I'm done working now, and let's talk about, how much money I'm going to get in cash benefits, monthly benefits, and my Medicare. But you don't have to wait to check your Social Security account until then. You can always open a My Social Security account at any age and check your progress on how you're paying in all your life. So a lot of this stuff is online, but you are correct. We need to start, and the good start date is at least 3 months before.
So here's a question that everybody has. So how much does it cost? And how do I pay for it?
Yeah. So if you're buying it, you can pay in through like a little automatic deduction to the federal government. And some people do come and buy our Medicare. They're living here. Maybe they never lived in this country, but they've come in and set up residency for 5 years. They can buy it. It's expensive. It'll be, I think it's $471. Let me check my facts. But let's say I came here, I've never paid into Medicare Part A. That's that hospitalization. It's $471 a month per person. Now, if I'm 65, try to get insurance for cheaper than that. So, when you look at it, it's like, okay, that's about a going rate. Part B would be $148.50, so it's a little less than $150 a month. So you'd buy both parts. So we're talking, what, $500, $600, almost $600 by the time you add a drug plan on top of that. So it can be costly. The average drug plan in the nation right now in 2021 is $33.06. Now there's plans out there that are, $12, $13, $14, but and there are plans that are much higher. So much choice. I'm just kind of hitting the averages here. And then you would check in with Medicare and Social Security and find out, do I have to pay for Part A? Because a lot of people, that Part A, that $471, you don't pay that because you or a spouse paid into it, and it's free. I have an aunt that taught school in Nashville, not far from you, and she did not realize that her school teachers back in the day never paid into Social Security, so they didn't have Medicare. But she married, so she was married all those years, and so my uncle paid in, and they are eligible for Medicare, and we were able to hook them up with that, and then her retiree insurance wrapped around Medicare. So she did not have to pay for that Part A, obviously, and they would be paying for Part B, which is your medical, $148.50 a month. That gives you a little idea.
So I hear our SHIP counselors, talking with people in the office, and there's a lot of information. So, and when we have one who talks about getting the book of all things Medicare out, and it's about this thick. So, yeah. But when we don't know the answer, we are always able to go to you, and you've always been very helpful. We appreciate that. You gave a couple really good resources. Number one, SSA.gov. So people should check that out. And then who pays first? And I'm going to make sure that we have those books in our office. So if people want to get those, they can get them. I'm almost certain we do, but if we don't, we will. And we have all the supplement plans and the Medicare NU 2021 books here too.
Oh,
so
good.
Yeah, so everything's said. If people have questions, they can call AgeSmart. So Sandy, is there any last bit of advice for that person turning 65?
I would, if you're savvy on the computer, which you're listening to this, so maybe you are, I would go out there and make a Medicare.gov account in your name. So you're going to put in your Medicare number and you're going to put some security questions in. It's all secure, and they're going to ask you some questions just like you would be asked if you were setting up a Social Security account. In that, you can print your own Medicare card. You can look at your drug list. You can download your drug list, take it to the doctor with you. You can get emails saying, hey, it's time for your Welcome to Medicare physical. It's time for your mammogram. It's time for this screening and that screening that Medicare covers. So Medicare kind of stays in contact with you, and no one else can access your information. It is a secure site. So I would suggest that. And then when you meet with a SHIP counselor, then we're going to say, okay, do you have an account? Wonderful. Let's look at your account. And then every year we can look at your, how your insurance is, check up on you. And during an open enrollment season every fall, a SHIP counselor can easily get in and look at your records and mentor you and help you on that. So it would certainly help us if you made your own Medicare.gov account in your name. And each person needs one.
And if you don't, we can help you make that. And we actually give you a card with all those great codes on it.
Oh, awesome.
There's a lot of security questions that are asked in that. So that's a great thing. Well, Sandy, I can't thank you enough for all the help you've given us throughout the years and for joining us today. And hooray for all of you turning 65. And do your due diligence and start reading right away. So thank you so much, Sandy.
Thanks for having me. Happy birthday, everyone.